Hi everyone, this is James Braithwaite here, and we are not in the offices of Braithwaite Physiotherapy in Toronto. As you can see, this is not downtown Toronto behind me. It's actually the woods in Quebec. We're at Mont Tremblant, north of Montreal, skiing for a couple of days, and we're going to talk to you today. Actually, the first thing that we're doing is just stopping in the woods. It's pretty beautiful here, hey? Some fresh snow's coming down. It looks amazing. The first thing that we're going to do outside of looking around is talk about mechanisms for ACL injuries, which is one of the most common injuries that recreational skiers incur. And in recreational skiing, the mechanism of injury for that type of problem is a sit back on your skis type fall. And just before we go any further, the ACL is a ligament in your knee that stops the shin bone from sliding forward on the thigh bone. Pretty commonly injured in this sport. So Erin, my good friend who is with me, hi Erin, she's going to demonstrate that sit back fall that we're talking about that is so dangerous for damage to this ligament. So Erin, go ahead and show us what you got there. So, oh, there she goes. Exactly. Can you show us once more? Yeah. The fall back, or the sit back fall. It's a really common mechanism that we tend to do. It's when we're scared or we're nervous or we feel like we're out of control, we have a reflex called the startle reflex. And you can see babies do it. Show us the startle reflex, Erin. Exactly. That's exactly what we do when we feel unsteady, uncertain, nervous. Babies do this all the time. If they see something or they feel something that they're not sure about, they'll do that extension reflex. And we do that when we're nervous on skis too. And it's a big part of the reason that we have so many sit back falls, and that's so dangerous for the ACL. That ligament, when you go into that position, gets stressed, and when you fall with some force on skis. So it's not uncommon to see that thing get damaged in that type of fall. So let's give ourselves a little bit of space. Let's go for a little ride, you and me together. Let's go down here. Erin, let's come down a little bit. Okay. So what we're going to talk about is we're on a fairly challenging little slope here, and we're going to talk about how you can position yourself to avoid the fallback injury. And maybe the main thing that you can practice when you're skiing, we're going to give you two main tips. Number one tip is to assume a more forward and aggressive posture on your ski. And Erin's showing us here. So show us a weak posture, Erin. Exactly. Now show us an aggressive and strong posture.
So sitting back, hands behind you, strong posture.
Forward. Yeah, exactly.
Arms forward, upper body facing down the hill.
Yeah, way less likely to have that sit back fall. And the second part of that aggressive posture is if you're not comfortable in the aggressive posture on the skiing terrain that you're in, find easier terrain to work in. It's better to have good form in terrain that you can handle than bad form in terrain that you can't. Actually, that's probably the worst combination of all, isn't it? So always pay attention to what where you're comfortable, what you feel like you're having fun and control in. It's better for your body physically, and it's more fun for you as a skier too. If you're skiing in control, you just have a better time. Everyone knows what it's like to feel scared and out of control on the ski hill. It's not a good time, so just try not to do it. So Erin, can you show us a ski down the slope? I know you can because you're such an awesome skier. There's a reason that I'm the one that's taping this and Erin's the one that's showing us the demonstrations of the good ski form, because she's an amazing skier, and she's going to show us a good forward aggressive ski posture as she sort of shushes down the slope here. Okay. Actually, just let me get into position here, Erin. Okay, whenever you're ready, Erin.
All right.
Oh, sugar, I lost her. There she is. There she is. Good forward posture. Good job. Yeah, got it. So that's the way to do it. And again, find a nice forward posture for yourself, and stay in control, and try not to have that sit back fall. That's the main one to avoid. So if you have any questions about this or any other physiotherapy or physical activity related questions, injury related questions, of course, don't be afraid to give me a call at Braithwaite Physiotherapy. And thanks very much to Erin as well. Thank you, Erin, for demonstrating for us today. Cheers. Have a great day. Have fun on the slopes. Have a great winter. And we'll see you next time.